well, I'll just say for a lot of our patients, there's a lot of angst around that, taking that first step. And I think a lot of that, again, back to the psychology, I think a lot of that stems from, we know now that there are genetic components to, you can have two people that take care of their teeth exactly the same, and one is okay and the other ends up in dentures, right?
Yep, that's right.
Just due to the pH that someone's body runs at, like you said, gut health, other factors and impact.
Yep.
But these patients that are trying hard and they come in their whole life to the dentist every 6 months, and every time, hey, you've got another cavity, you're not brushing and flossing, oh, you got this, you got that. It almost feels like they become like a dental failure, right? And then they just disappear from the system. After so long, they're like, you know what I'm trying isn't working, and I'm not getting the result. So it's like the dental system has failed them, and then they just disappear. They're gone for 10 years, things get worse, and then they want to come back and like address it head on, but they don't want that interaction where they come in and they get judged and scolded or whatever else they're used to. So
it's a cycle, right? They get in this cycle of like coming in, it's expensive, but nothing really gets resolved. There's no real solution, and they might get a partial, they might get some treatment on their gums, they might get this or that, and they don't last, or they won't wear them because they're uncomfortable, they don't fit well, they don't look right, and they kind of just...
It's a chasing your tail scenario that they eventually give up on, and I think we get that, and that's why for our whole team, that's always been our ethos. Is it's a zero shame situation. It's a safe space.
That's right.
We know that maybe you could have done stuff better, but there's no reason to harp on that. We just want to get somebody in, understand where they're at now, not dwell on the past, but say, okay, this is where we're at, and this is where we can go, and come up with a solution. So I think when once somebody gets into one of our offices, they feel that, and it's good to go. But that's sometimes the hardest part, right? Is them just overthinking it.
Kudos getting in the chair, because that's oftentimes, you're right, that's the hardest part, is walking in that door, getting in the chair, being a little vulnerable that first visit. Once they're there, I think the comment we always get is how comfortable people feel. Right. And generally, we'll take a 3D x-ray. That way we can give some answers right away. And we'll sit down away from the dental chair, from the sounds and smells of the dental office, in a consultation space. And in that space, we can have a direct conversation, answer questions quietly, one-on-one, which is really, really nice. I think people enjoy that interaction without feeling, like you said, judged, feeling like they don't really know answers or anything like that. But here we can say, hey, here's what we have, this is what we can go for, is this the right fit for you? And not everyone is what do they say? If you have a hammer, everything looks like a nail.
Right.
And that's a different thing in the way we do things, is we have it set up where you can do general dentistry or the implant center at the same facility.
Right. Yeah, and I think that's really kind of more aligned on our ethical code, or our moral thing of the thing we make back as when we first start school of do no harm.
Right.
It's patient centric, is we really. And I think that also plays too. We get the question all the time on the phone. Well, can't I just get a quote over the phone?
Right.
And I mean, it's hard, right? It feels a little salesy, like, no, you need to come in. But really, you need to come in, because we don't know. We have people that say, I think I need a full mouth of implants. They come in and we're like, actually, you just need some
better than you think.
Short-term ortho, some clear aligners and some bleaching, and you're good to go.
You're good to go.
And we have some people that come in, they say, I think I need an implant. And they come in and...
a lot more extensive.
Yeah, it's worse than we think, So I think that, and that's why we try to make that barrier so low for the consultation, is, just come in, let us get that 3D x-ray, let us take a look, and then we can give you that answer of this is what you need.
Exactly.
But it's, like you said, it's patient specific. Everybody's different, and everybody's going to have different options. And then I think also part of the consult process that I enjoy is the patient. Like, where's the patient at? What do they want? And we really try to drive it off of their goals, right? Because I could, again, have the same person come in, same x-ray, same clinical condition when I do my check. And if one tells me, hey, I want to save my teeth at all costs, that could be a different direction than someone who says, I'm so tired of chasing my tail, I continually have issues, and I want something that's implant based.
And I think it's important that when you go talk to a dentist and try to figure that out, that you find someone who is listening to you.
Yeah, 100%.
I think there's the guys who, like I said, they're gonna push it. Hey, this is what we do. Come in, we'll do this one treatment. And I don't think that's right. I think everything needs to be customized to the individual and their needs. Look at their history and see how we can best guide them as a profession, as dentists. I think that's really critical, that we guide in the right direction. And part of that is we put it up on the screen. We got a big screen in the office. We're able to go through and together as a consultation, but really as an advocate, like, hey, we're trying to help you out. Let's look at it together. Let's solve some problems as a team.
Well, yeah, and I think our thing is maybe we can get some street cred back for the profession, right? It's you always hear that, oh, dentists or shysters, or they're in it for the money.
Yeah.
And it's like.
Well, I look at my own family. My mom had an old bridge. She had a baby tooth that had gone out, and the bridge was failing, and she needs some work done. And so when people come in, I think the same as, hey, my mom's here. Like, what would I do if you're sitting in the chair, Mom? Like, what's the right thing to do? And I think and hopefully people feel that energy. And hopefully you feel that when you come in for a consultation with whoever dentist you sit across from, is that we really are just trying to do the best thing for you. And ultimately, when you're happy, everyone's happy. It works out in the end.
Yeah, it's like any industry, right? Where most people out there are good, honest people trying to do the right thing.
Absolutely.
But it's those couple bad apples that kind of spoil the bunch.
Sure.